For many years, clinical trials have been an important step in discovering new treatments for diseases, as well as new ways to detect, diagnose, and reduce the risk of disease. Clinical trials help researchers and doctors decide if the side effects of a new treatment are acceptable when weighed against the benefits offered by the new treatment. This background gave birth to European and Developing Countries Clinical Trials Partnership, EDCTP. Zambia hosted the 8th EDCTP Forum held from the 6th to the 9th of November 2016 in Lusaka. The forum, which was being held in Zambia for the first time, offered a platform for researchers, scholars, policymakers, and leaders to share and discuss the various aspects of clinical research on poverty-related and neglected diseases in Africa.
This is a program that is a public-public partnership which is involving both European and African participating states with the European Union.
EDCTP aims to support collaborative research that accelerates the clinical development of new or improved interventions to prevent or treat HIV and AIDS, tuberculosis, malaria, and neglected infectious diseases.
So the diseases we're tackling are, of course, diseases prevalent in sub-Saharan Africa. We don't have the same diseases in Europe. But the research experience and the laboratory expertise often comes from European countries. So it's trying to ensure that we work with the best scientists in African countries to be driven by the questions that they themselves would wish to see addressed, but bringing some of the expertise of the European scientists to help them solve those problems.
President of the Republic of Zambia, Mr. Edgar Chagwa Lungu, became the first African head of state to grace the European and Developing Countries Clinical Trials Partnership Forum after he officially opened the 8th EDCTP conference held in Lusaka, assuring continued support in the public-to-public collaboration.
My government's vision resonates very well with the ideas of the forum because we are pursuing a vigorous, inclusive development agenda whose cornerstone is not to leave anyone behind. I trust and hope that this forum will engage openly and candidly in dialogue that will result in a transformative health research agenda. Transformation will mean that we look not only at improving the way we do business in health service delivery, but also to interrogate the objectives we have set for ourselves.
Well, the theme for this year is defeating poverty-related and neglected infectious diseases, harnessing research for research-informed policy. Now, often we generate research results, and these results are not translated into policy.
What we've been thinking about at this meeting in particular is how we can improve the coordination or the communications between scientists on the one hand, funders and policymakers to share both in the design of the science, design of the research, and think about how we can then implement the research into policy.
Policy making is complex. Policy making can be influenced by many factors such as people's beliefs and their theories about how things work, vested interests in politics, the values that different people have and ideologies, the habits we have, and then of course the structural, cultural and financial constraints under which people have to make decisions. And under the weight of all these factors, it shouldn't be surprising that sometimes research evidence, the use of research evidence may be inconsistent.
The conference recorded over 50 presentations by researchers, displayed 150 posters relevant to advancing research against the poverty-related and neglected diseases.
And when I talk about clinical interventions, I imply development of new medicines, which may include drugs, vaccines, microbicides, and diagnostics that are to help in the diagnosis, prevention, and treatment of these diseases that really are a big burden to sub-Saharan Africa.
In addition, the conference had 9 symposia organized by EDCTP stakeholders, 5 educational workshops, meet the expert sessions, panel discussions, satellite meetings, and award presentations.
What we want to know is what is the demonstration that the results that have been developed are taken up by the government and made into policy so that it can be implemented to improve the health of people in Africa.
That doesn't mean to say there's always going to be an outcome of research that has to go into policy, but some of the research also needs to understand the limitations of the health system to deliver the outcomes of the research. So if you develop a new vaccine, how are you going to get that vaccine into the population? How is it going to be distributed? How is it going to become part of the national program? That is, of course, something which has to be decided at a government level.
Veronica Mulenga of UTH Zambia described her experiences working on a trial for a much-needed new ARV formulation, the so-called baby pill, for HIV treatment. Her study was published showing adequate drug exposure can be achieved with the pill, and soon after it achieved FDA approval. Supplies of the drug became available in Zambia. But 2 years later, only 30% of children who needed it were getting it. The problem that she has identified has been that the publication of the trial came just after the publication of Zambia's own treatment guidelines. Information about the baby pill trickled down only slowly, barely reaching clinics in the outer areas. We need strategies on how to rapidly transmit new information.
The high burden of diseases of poverty and neglected tropical diseases cost the lives of millions of people worldwide and threaten the health of millions more. Records show that more than 200 million health years of life are lost every single year due to mortality, morbidity, and disability, which calls for new efforts in developing effective and efficient approaches to control or even eliminate these diseases.
If you look at the challenges, health challenges we have in Africa, you see that we are still facing the burden of infectious diseases. And many of these infectious diseases are neglected diseases. But at the same time, we see the burden of chronic disease also increasing, of diabetes, cardiovascular diseases, cancer. So the challenges for health has become more and more complex. EDCTP approach is part of the solution, or bring that solution. Why? Because first, it has a long-term perspective. It has cycles of 10 years. And this cycle of 10 years gives some stability that you don't spend every 2 years writing a new project, new proposal, which sometimes is frustrating. The second aspect is that it brings, as an important component, the training of African scientists and researchers, which means that our internal capacity is increasing, and Zambia is one example of it.
The award which is going to be presented is the recognition of the excellent work jointly carried out by the University of Zambia Teaching Hospital and the University College of London.
Over the last 22 years, we have written over 500 scientific papers. We are talking about 500. Out of those, probably 102 are in the biggest journals in the world. And we have done research where we have changed policy. We have done research where we have improved diagnostics in TB and HIV. So, and we continue to do that. And now we are working on immunotherapies and all these other diseases of neglected people. We have done post-mortem studies to know what kills Zambian people. And those interventions have been very helpful.
I think the message really to our policymakers here, this is including our heads of states in Africa, our ministers of health, is to make Africa proud by demonstrating that Africa is an equal partner to the Europeans in this partnership. And this means meeting our financial commitments, getting involved in the General Assembly meetings, because you know the partnership is made up of 14 African countries and 14 European countries, but that have got equal votes. Make the decision that is being made involves the Africans and the Europeans coming together and deciding what the outcome should be.